Okay, guys, so I am in my Nursing 1 Fundamentals of Nursing class. Basically, I'm in clinicals, and I just wanted to share with you guys my experience and the things that I have learned thus far in my clinical class. So I have this mnemonic book, and basically it has like all the mnemonics of nursing. I also have a couple of worksheets from school that I had to fill out by myself in order to learn the landmarks, which is pretty cool. Before nursing school, I purchased a book called Memory Notebook of Nursing, Volume 1, the 5th edition. To be quite honest with you guys, this book is really not needed. I was just having like a panic attack or anxiety, whatever you want to call it, because I wanted to be well prepared for class. But in school, I mean, the teacher hands out a ton of paperwork with all these riddles and things like that. This is something really cool I just wanted to go over with you guys for auscultating the heart sounds. It's called ape to man. This is going to be a mnemonic that is so easy to remember. So ape, A, you think of aortic, P, you think of pulmonic, T, you think of your tricuspid, and M, you think of your mitral. I also wanted to point out the cardiac landmarks are really important to know, especially for our class, because was something that we actually got tested on when we were doing our clinical evaluations. And this sheet right here, I just had it as a study guide, and I basically just dropped down the ape to man once again. By far, one of the most important things that I had to learn was the cardiac landmarks. I had to know that the aortic lies on your right sternum border, second intercostal space, and is distinctive from the pulmonic, which is going to be on the left sternum border, second intercostal space. One of the key things that I had to remember was S2 and S1. So when you hear your lub dub, always remember that it's S1, then S2. S1, S2. Within our clinical class, all of the students also had to learn the pulse sites within the body. There are 9 pulse sites, and these pulse sites, I had learned these pulse sites really fast. The way that I actually learned it was by making a photocopy of this picture right here, and I just placed it basically on my mirror. And even when I was driving to school, I basically just took out the flyer and I just learned these pulse sites. With the stethoscope that I have, I am going to get a little bit creative because I did not have anyone to auscultate. So I'm going to use myself, and I will be sharing with you guys exactly how I actually do this whole process. Starting out on my assessment, I would want to start to feel the pulse for the carotid artery, one side at a time. So never, ever, ever take the pulse on both sides at the same time, just because you can occlude the blood flow, which leads to dizziness and even loss of consciousness on a patient. And just a really quick tip, if you're unable to feel the pulse, just ask the patient to hold their breath, and sometimes that can actually help with feeling the pulse. A really quick FYI, I just wanted to point out that the diaphragm detects the higher pitched sounds, that is the wider part, and the bell, which is a smaller part, it detects the lower pitched sounds. So this is how I was basically taught to hold my stethoscope. This is where the cardiac landmarks come into play. I'm going to start out the process by auscultating my aortic, which is located on my right sternum border, second intercostal space. Then I'm going to move to the opposite side, which is going to be my pulmonic, which is going to be located on the left sternum border, second intercostal space. Then I'm going to move down to my Erb's point, which is the left sternum border, third intercostal space. Then I'm going to move down to my tricuspid, which is my left sternum border, fourth intercostal space. A really cool trick that I learned in class was we actually feel the collarbone on the patient, and we go in the middle of the collarbone, go straight down to the nipple line underneath the breast area, and that is going to be your mitral slash apical, which is going to be your mid-clavicular fifth intercostal space. The mitral slash apical pulse located on the mid-clavicular fifth intercostal space is actually listened to for a full minute in order to figure out the patient's pulse. In order to complete the assessment for lab evaluations, I just had to turn the diaphragm around and get to the bell in order to listen to those low-pitched sounds, and I had to continue to hit the landmarks the same ways that I did previously. So that was the ape to man. Some of the things that I had to learn and be familiar with were 2 additional sounds that could also be heard and auscultated. For example, S3, which is an extra sound that could be heard after S2. It's basically an indication of an early diastolic, and it occurs during passive diastolic filling. It's low pitch and it has like a long duration that is best heard with the bell. And basically you're going to hear this in the mitral and the tricuspid area, and it could indicate heart failure, but you're going to hear, the sound that you're going to hear for is going to sound like lub, dub, dub, lub, dub, dub, lub, dub, dub. S4 is another additional sound that also can be heard. It occurs before S1. It is really a loud sound due to a ventricular stiffness. Best heard with a bell because it's also a low-pitched sound. So basically, when you're listening to S4, what you're going to listen to is for a lahub dub, lahub dub, lahub dub, lahub dub. So you could actually distinguish the differences between those 2 sounds. Thus far, this is what I have learned, and I wanted to share with you guys exactly how my Nursing 1 Fundamentals of Nursing clinical experience is going. Thank you guys so much. Please don't forget to subscribe. I will be adding so much and so many more content. Thank you guys so much for watching. Please stay safe.